our engagement rates for like the 61 to 91 are 20 to 30% higher than all other age groups. It's simple. It's easy. You make things easy for people, they will use it. And you know who wants healthcare to be easy and to do all the things to stay healthy and well? 61 to 91-year-olds, which is exactly who we want to stay healthy too when we think about like societal costs.
Ladies and gentlemen, welcome back to another fabulous episode of the Healthcare Trailblazers Podcast. Excited to be sitting here today with the wonderful Carrie Kozlowski. Carrie is the co-founder and COO of Upfront Healthcare and has done a bunch of tremendous things and is one of the people that is really driving innovation around patient engagement. And so, Carrie, thank you for spending some time with us today.
Thanks for having me. I'm excited to talk.
Pleasure. So let's take a little trip down memory road. Where did you grow up and how did you get involved in healthcare?
Oh, that's a good question. So I started, I grew up in the Midwest and then Houston. So I moved around quite a bit growing up. I think that taught me a lot about adaptability and adjusting to different people, cultures, teams, as an athlete too. And really,
What'd you play?
Pardon? At basketball. Yeah, I'm very excited for Caitlin's game tonight. It's on the calendar. So looking forward to that. But yeah, so I think that piece of it set me up for healthcare and for entrepreneurship though, because it really taught me that you have to kind of listen to what's happening around you, figure out how to fit in a little bit when you're moving around in, middle school and high school, and adjust. But always I've been a caregiver. So my healthcare career started actually in clinical. I started as an occupational therapist. Thinking that I would eventually go to med school, but wanting to have, or maybe my father wanted me to have a vocation at the end of my bachelor's degree. And so did OT, loved it, practiced in a number of different facilities across Houston and Chicago, really enjoyed working in safety net hospitals and thinking of ways in which we could get creative to meet patient needs in circumstances where maybe it wasn't as easy as suburban Chicago to do so. Ultimately, found that there was an opportunity probably to grow my impact. And so thought I would go back, did my B school degree here in Chicago at night, and with the plan that I would probably do hospital administration. Like, how do I grow my impact by moving up the ranks in hospital administration? And by good fortune, had an entrepreneurship class with my co-founder, Ben Albert. And we were that group, you remember college classes where there's like 30 people and there's a group project for the whole semester and like 5 groups form. And then there's just 5 people sitting there. That was us because we were the work full-time, school full-time people. So we got put into this group together and worked on a business plan, presented it, won the competition that year, and then really built a relationship based on our complementary skills and have worked together he pulled me into healthcare tech. And have been together for 20 years across 4 or 5 different companies now, actually. So
really,
yeah, we've had a long professional career together, and so a lot of trust and a lot of shared mission and effort. So that's a big part of, I think, any successful venture in healthcare is that foundation of trust and mission alignment.
So the first thing that stood out to me from what you've said is that you kind of had a bunch of jobs and kind of slowly transitioned into entrepreneurship. And it's interesting because a lot of people tend to think of the entrepreneurial bug as kind of like a binary personality, that you're either an employee or you're an entrepreneur. And entrepreneurialism has become this like romanticized thing. Which also has become extraordinarily easily accessible because all you have to do is pay $9.99 on Wix and open up a website, call yourself the CEO, and you're done. And so, my question to you is, how did you go through that internal journey? At the end of the day, it is 2 very, very, very different approaches to life, to risk, to what you want out of life. And so, from a security risk perspective, how did you approach that journey, and what was that like for you?
Yeah, I think you're hitting the nail on the head in the first summary, which is it's been a very organic journey for me, my career. And that is, I do think I go back to your first question around like kind of where I grew up and moving around a lot. Like I sort of take the next opportunity when it's presented. Like, that sounds interesting. That sounds cool. That sounds like something I'd like to do. And I think in general, where my passion lies is in mission, making healthcare better, easier, simpler for patients and providers. but also how do I solve the problems that they're facing, right? What is the problem? And then I love that. Like this is the math aspect of it, the communication aspect of it, like digging into it, like that deep curiosity aspect, like all of that is really what drove me into entrepreneurship. I don't even know that I knew that's what it was, right? Like that's the part of like your career is kind of organically growing. And then, next thing you're, employee 60, then you're employee 7, and then you're a co-founder. It kind of just slowly evolves. I did say before this one, that I wasn't doing another one again. It's a lot of work. It's an emotional investment. It's a physical investment. And I took a sabbatical. I spent a good amount of time really reflecting, reading, researching, talking to everybody about their careers. And turns out I'm suited for this. And Ben was starting to call. And it's like, I have an idea of something. Let's bounce it. Can I bounce it off you? Like talking it through. And I was like, yeah, it sounds great. You might want to think about this and this. We could go here or there. Have fun. And he would call again. He's like, do you want to do it? And I'm like, I don't know. I'm not doing this again. But eventually, right, a little self-reflection and a really fun idea. And it's hard to say no, right? When you really have that bug of wanting to solve a problem and make healthcare better. And that's like my whole life. I've just been really passionate about healthcare.
Okay, so before we get into what that idea actually was, the thing I'd like to highlight is because through speaking to so many people like yourself, this is how I've kind of reframed that binary thing in my own head, and I think it makes a lot of sense. And to me, you're proving the point. And I look at, as of late, I kind of look at entrepreneurialism kind of like a comedian, and I think there's two types of comedians. There's one comedian that sits with a pen and paper and tries to come up with a joke, and they work really hard. And they come up with a really good joke, and then they rework it, and then they test it on the crowd, then they change the front line, they change the back. But they started by thinking, how do I come up with a joke? How do I be funny? How do I be funny? How do I be funny? And then there's other types of comedians that are simply funny. And they just walk through life and they see the same things that we see, but they see them through a comedic lens, and they just say funny things. Like the reality is a funny reality. And that's how they and I think that that's how entrepreneurialism actually works. I think that there's a lot of people that think when they're starting out, I want to be an entrepreneur. So they go to their basement, they make sure they're broke, they sit on the floor, they buy ramen, they eat the ramen, they don't even cook it, and they sit there and they just say, I'm an entrepreneur, how do I start a company, how do I start a company, what can I start? And there's another type of person that, because the key thing that you said, you were just consistently trying to solve problems. And the other type of person is just going through life, and that might be at a job, and it might be as an employee, and it might be but you actually don't, and you may not even realize this, but you have this entrepreneurial lens on, and you see challenges, and you see opportunities, and you see where they kind of come together, and you see those things that other people don't see. And at some point in your life, you're going to get to the point where you're just naturally going to start something, and it feels genuine and it feels natural because that's your lens. You're an actual entrepreneur, right? What do you think?
I think I agree with you, and I think that my superpower is this ability to process a lot of information, assimilate it really quickly into kind of a thoughtful next step, and then evangelize it. And that is what entrepreneurship is. That's what you're describing right now. I think that what is the difference maybe too, I think about in the two kind of types of entrepreneurs you're describing is it maybe a little bit of a show your math. Like a lot of mine is very intuitive. So like it's hard sometimes to see, like I went from A to B to C to D, sort of at A, I'm sitting in 5 prospect meetings or a couple of client meetings, and I'm hearing their problems and I'm hearing what they're trying to solve for. And I'm thinking about how that comes together. Okay, how does the engineering aspect of what we do work? How does the technology aspect of what we do work? What is the problem they're trying to solve? What is their service element to that? What's the process? What's the people? And then immediately it sort of like comes together for me. And then it's just this constant iterative process, which is what it should be. And if you're an entrepreneur and you're starting with an idea, I think this is where there's a lot of risk in entrepreneurship, because you're not right. Whatever you're starting with is not right. Like or rarely, I should say, but let's be fair. It's not 100%, but it's rarely right? Until you go out to figure out product market fit. And if you're not willing to listen, assimilate, adjust, and iterate, you really will struggle to survive. Like that adaptability is absolutely essential to a long entrepreneurship career, I should say.
Yeah. Yeah. So what was that idea? Ben calls you, and what was it?
Yeah, I mean, so what we do at Upfront is patient engagement, and our mission is to guide every patient to the care they need. And that sounds really simple. And where we started is we obviously, as I said, done a few startups before, and what we were finding, especially in like the 2008, 2012 timeframe, was a couple of things. One, we were really focused on populations. We were, right, Ben and I, and how do we help the population get better, population health. And what healthcare was doing was focusing on some new contracting ideas in value-based care, and they were focusing on the 1% of patients in those contracts who were high risk. And so while we were trying to solve problems with technology and products that we were building at the time, the market was really just trying to get through a very like human-centered approach to care managing a very small amount of people who are already high risk. Like we weren't thinking in a prevention mode. We weren't doing any of that stuff. And honestly, we were really early in interoperability. Like we just really weren't there in terms of sharing data. And so we kind of came back together in 2015 and 16 to think about this idea. We were like, hey, there's been enough advances now in interoperability. There's enough advances in smartphones and technology and how we can reach people. Is there a way for us to guide patients to the care they need in a much more scalable way that doesn't require humans? Because there's just not enough of them. Like there aren't any. And so how can we put some constraints on ourselves? One, that it works for every patient. So behind the scenes has to be smart enough to adjust intelligently content, information, navigation to what that patient's data is and what they need. Two, it can't add any extra work to a clinician, provider, front desk staff. There can't be clicks that have to happen in order to facilitate it. And then there has to be friction removed. And most importantly, friction from logins, another name, another password on either side, right? But primarily for patients in order to do this. And so that we put these constraints on ourselves and then started to figure out how we might get there. What's interesting is we did this, like the initial idea, we started forming the company in 2016. We were really thinking about probably a little bit more around potentially payments and slot utilization. And how do we help get the right patients into care by thinking really smart about slot utilization and front end revenue cycle and things like this. What happened in later 2016 was there was this big election and there was a lot of fear in healthcare around what might happen to the ACA and what we might do. And we had to get creative as entrepreneurs. We had to really think differently about how we're going to grow this business, because selling software wasn't, especially early stage software, probably wasn't going to happen at that point in time because people were risk averse. And so we took kind of our team, we took our relationships that we'd built in the market, and we built pretty big relationships with a few big health systems, and we studied their data. And we looked at what they were doing. And at that time, we were early in retailization. We were really early in health systems leading ambulatory care. They were doing ambulatory care, but they weren't leading in ambulatory care models. And so we started to understand that the real problem that we could solve and that wasn't being addressed was retention. How do we, everyone's focusing on acquisition at the time, right? Get new patients in, and they're falling out the back end through the sieve. And so how do we look at what's happening with patients? How do we look at which patients should come back? How do we bring patients back in for necessary care, right? So we're not driving false revenue, false visits, thoughtfully doing that, and make it beneficial to the patient and the provider when that care gets completed. And so it pushed us in a totally different direction, ultimately, because we, out of necessity and out of interest and curiosity and flexibility, all of those things allowed us to go in a really kind of new way. And I think that ultimately was a huge part of building the early foundation. Obviously, was a huge part of building the early foundation of the company.
So at the beginning of this idea, you thought of a reality where this technology was easy for patients and no double, triple, quadruple logins and ease of data. And what you're describing sounds very, very, very familiar, except that it sounds like the exact opposite of healthcare. Like it sounds like you're trying to build an Amazon or like a shopping experience, like
driven experience. Yes,
exactly. And so, how did you even start marrying those two worlds of ease and convenience and the world that we know today of healthcare, which is tremendously difficult to do anything from a data, from an interoperability perspective. How'd you even approach that?
Yeah, I mean, I think through that opportunity where we were really doing some deep analysis, there's a tremendous amount of data in healthcare, right? I mean, I don't even know, like healthcare is growing faster than any other industry in terms of the data it's producing. Like it's phenomenal amounts of data are getting created all the time. What we realized was we didn't have to ask the patients what they wanted. We could use the data that we were seeing to understand what they needed. And in doing so, it just feels like I'm being like the idea that I could be breadcrumb on what needs to happen in my healthcare journey. It's all there in the data. Like, what do I need to do? Where do I need to go? If I go to some major retailer and I buy a new dress, I'm probably going to get an ad for shoes or an email about shoes that match that dress, right? Why do I go to a visit and not have somebody navigate me to the referral afterwards? Why do I have to remember all year long when I'm supposed to get my mammogram and my wellness visit? Oh yeah, my kid's stuff done. Like, why do and worse than that, like, because we do decent job when it comes to care gaps in healthcare, but like you do anything, be it's not a measure, no one's following up on that. You need a, ultrasound on your thyroid every 2 years for some benign need, or you have a benign lung mass supposed to get scanned every couple years. But it's all there in the data. Yeah. And if you did that for me, I would feel like you were leading me, making my life easier, right? If you're easing someone's way and it's intelligent and it feels like you know me, I'm going to be pretty loyal to that experience, because why not? I don't have to think. And that's really all that data thinking.
So what is the actual upfront experience? First of all, who's the user, and what is it, the patient, and what does it look like?
Yeah, so our clients are, large health systems, everything from safety net to academic medical centers, regional, et cetera, or urgent cares, large medical groups, even some of the vendors in the value-based enabler space, and care management. And ultimately, it's anyone who's delivering care to patients. So our end users are patients. And what we're doing is we're navigating them to that care. We do that through omni-channel communication. So first we have to get their attention, obviously. And then we present them with a curated set of information. So think of it, a microsite's an easy way to think of it. It's a set of content that is time-based, right? So at this point in time, we need you to do this. And then the content that we use.
As a patient, where am I seeing this content?
You get a text message. I'm hitting a link, I'm going right there. Super easy. Don't have to think. Don't have to go to an app. There's nothing to download. You're not logging in anywhere. And it's bringing up content that not only tells me what I need to do, it speaks uniquely to me. So we use the concept of psychographics. We have the only healthcare psychographic segmentation model, which is really what are motivations and influencers that drive patients' buying behavior or action behavior in healthcare. And so we're using that kind of content. We're navigating them to what they need to do, but then we're removing the friction in doing it. So even today, if you mail me the letter that says I need my mammogram, I get on a phone call only between the hours of 8 and 4, not during 12, right? Which I'm super.
And the holding time is only 45 minutes.
Right. And then I got to answer 72 questions, right? I'm on the phone for 17 minutes. And then I can schedule it, right? So
then you get transferred, and then you answer all the questions again.
Right.
Yeah.
And then while I'm there, do you think a single person saying, "Hey, Carrie, while we've got you on the phone and you're taking off work that day, did you also want to go see your doctor for your wellness visit and flu vaccine?" No one's doing that. Like no one's curating that experience for me, which we have the information to do it. So that's that's what we're doing, is we're bringing it all together, and then we're removing the friction. So through interoperability and integration, we can actually surface visits right out of the EMR and then write them right back in, so that I can just pick. So while we're on this call under the table, I could literally be like, "Oh yeah, my mammogram Tuesday 10. Yep." Right. And continue right through the conversation. And it's so easy. And that's there's no reason it can't be this simple, and it can't be in a consumer oriented framework.
Well, I think a lot of people would love to be able to do this, and not that many people seem to be able to actually move the needle on it. So it seems simple, but it obviously isn't. And more than simple, it seems obvious. And this is one of the wild things about healthcare, that it's so convoluted, and yet a lot of it is so simple. Just look at any other industry. Human nature doesn't change all that much, to your point, between your buying tendencies and the flow that you'll go through in navigating your care. Like, and yet we can't seem to make, or not that many people seem to be able to make serious progress on it. So going back to the challenge piece, like what you're saying sounds wonderful to me, and I would love for healthcare to be like that, but it still isn't. And so what are some of these big fundamental barriers that you guys keep, I would have to imagine, butting your heads against?
Yeah, I think change is hard in healthcare, and people are risk averse. So if we take the first one and break it down, healthcare is a very siloed like delivery model. And so what happens is we tend to think about problems in healthcare if we're on the delivery side, and I have been, right, in a little bit of a narrow focus. So I need to solve the problem of getting people to get their care gaps closed. And someone else is solving the problem of making sure people attend their visits, and if they've canceled, following up with them. Someone else is solving the problem of making sure they schedule their referrals after the fact. And so when we think about what we do, which is orchestrate that entire experience in a highly prioritized, like patient-oriented way, that's the challenge, is how do you bring all these people together to make a decision that elevates the entire experience, the entire journey that a patient goes through? It's hard, right? And I think that when you think about how many priorities there are in healthcare, when you come up to that level of like at the strategy, the cabinet, the CEO, the executive team, right? Then it's really, is this a priority for your organization? Is access a priority for your organization? Is engagement a priority for your organization? Is building long-term loyalty a priority for your organization? And do you want your organization to feel like the experience with your health system, urgent care, what have you? Do you want it to feel different than everybody else? Or you can like kind of base check the box or let everybody buy their $50,000 point solutions and let that be. And
Right.
here will continue as it has, right, for all these years. So I think that's a huge part of it, is the change management, alignment on priorities, strategic thinking. On the other side of it, I think the risk averse, it comes back to data again and compliance. So people are really averse, some people more than others in healthcare, to using data to engage patients and to share that. Like there's a compliance risk. I mean, and we're right. There's a lot of litigation, right? So I'm not going to pretend like it's like, oh, it's not that big a deal. Like it's real. And we look at like, we're storing all this data in healthcare. We've already assumed the risk at that point. And then you add what's going on in cybersecurity right now. It's significant. So we're assuming all this risk, and then we're just fencing it all off because we're risk averse. Well, once we've assumed the risk, we should be seeking a reward, right? Like that's the words go together essentially. So the reward for assuming the risk should be that you can use data to create a completely different experience where people can get care, barriers are overcome, and we can actually build loyal, strong relationships with our patients so that they can stay healthier. And we start to think about total cost. But we're just taking all the risk and not taking any like opportunity for reward. Like that's the like. Obviously, like it's mind blowing to me sometimes. Like, and I'm not a lawyer, so I'll disclose that much. So
we need someone to talk very fast and do the terms and conditions. But no, you could not have said it better. I mean, it is absolutely mind boggling. To your point, it's wild, and like the system's already. You said it perfectly. The system's already taking all the risks. They're holding the data. They're collecting the data. We're doing it. And then I have to sit there, sign in 6 different times. Every time I get a message, I got to sign into 4 different things I don't remember the password for. Then I have to reset my password. Then they have my cell phone number wrong, so it goes to my email. And then I have to reset my... It's impossible,
And penalty you get for being proactive.
Yeah.
So why would you be?
Yeah. And I'm 27. Now imagine if I was 72, it's literally impossible.
Wild. You'd be surprised too that our engagement rates for like the 61 to 91 are 20 to 30% higher than all other age groups. It's simple. It's easy. You make things easy for people, they will use it. And you know who wants healthcare to be easy and to do all the things to stay healthy and well? 61 to 91-year-olds, which is exactly who we want to stay healthy too, when we think about like societal costs. So it is this myth, right? Like that older population won't use technology. Sure, well,
Right.
we're using iPads and iPhones, like, because it's freaking easy. Like, that's why.
Right.
So,
Right. Maybe you just have a really crappy technology. Maybe if it was good technology, they'd use it. Right. That's funny. That's really great. So speaking of the demographics, and I was going to ask you that about the seniors and the engagement, but you just answered that. And so if you had to focus on an age group to start preventive care, what would be the most impactful age group to start honing in on preventive, where you're old enough that you start taking life seriously, but you're not too old that you've already done the damage?
yeah, that's a really good question. And probably one that's grounded in more clinical research than I have at the ready. I do think it's probably in that 35 to 50 range. Just it's intuitive to me, that answer, not necessarily because I'm a doctor. But I think at that range, there is probably a sense of some maturity, to your point, and time to do that. At the end of the day, like, I think nobody wants to be sick, right? But everybody is slightly different in how they interact with the healthcare system. And we just have to find the motivations. And like, this goes back, I was saying like earlier, the psychographics. It's really fascinating to me when you look at that. So if there's a group of people, we call them willful endurers, who will withstand the pain, wait to the last minute. They use 67% of urgent care visits. This group of this like sub segment of the population. Fine, right? So those are not the people, like, we talk all the time in healthcare, like, you have to have a relationship with a primary care doctor. If your relationship with a primary care doctor, you have better health outcomes. Yes, that's true. Except that, like, we're trying to get to better health outcomes, not relationships with primary care doctors. No offense.
Right. One means to end.
Important. I have one. However, some people aren't going to do that. So we don't need to make this first hop step. If you want to go get your A1C at urgent care, if that's what they do that, if you want to get your annual wellness at urgent care, if that's easier for you, if that's how we get you there, when we know that and we put that option in front of you, you're way more likely to get your wellness visit. And there's also a really smaller group of population, less than 15%, that are trustful responders. If their doctor says it, they're going to do it. This is how all healthcare marketing is done, though. It's all doctor says, right? All pharma, all these things you see. But it's a very small population, but those are not the people that we want to be encouraging to use other sites of care. Those are the people we want to say, hey, we got to get your care. Your doctor wants you to get it, and let's get you in. And so the other thing we have to think about in healthcare, and I guess taking us on a slightly different tangent, is we have access problems, but we have capacity. We just haven't helped patients understand easily how to take advantage of the available capacity, intelligently distributing the demand across capacity. And I used to think it was going to be about visit type or clinical need. Like, all the ear infections that are simple should go here. All the heart failure patients should go to primary care. It might not be that. It might be more about my motivations and influences, and people who need to go to the care down the street with 24-hour notice, because that's when they're more likely to do it, we send there. And people who really want a long-term trusting relationship with a degreed physician that they're going to see on a regular basis, they should do that. And so I think this idea that we can be smarter around how we think about access and how we help patients access care is a whole, like, when we started this company, I didn't think about how we might do it. It is a huge opportunity to inflect change in our healthcare system, though, and we can create more opportunity for patients to get care.
So you actually, I think you just unlocked a new piece of a large puzzle in my brain. And this is something that I've been talking about with innovators, doctors, since the beginning of this podcast. It's something that plagues me. And that is that the very fundamental dynamic of healthcare is really perverse. It's weird. And that's because the dynamic is that the doctor is the one that's responsible for my healthcare. They're the one that gets paid for it, and they're the one that gets dinged for it in value-based care, right? Mm-hmm. And so whichever way you spin it, they're the ones that are incentivized to make sure I'm healthy. And that's weird. I think that's the best word I can put to it. Because if you think for a second, move that over to like to the financial space. Imagine if you had a financial advisor and the dynamics of that conversation was the financial advisor was begging you to just sit down with them for 20 minutes a month to go over your finances. Please, 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 please. You might sit down with them, you might not, but probably you're going to walk out of there and rack up bad debt on your credit card.
Yeah, totally.
So what I've asked again and again and again, and I've gotten small pieces of the answer. Last week, this week, I was in Chicago with Oak Street Health. I asked them the same question. Dr. Gordon Chen from ChenMed has a really good answer around it. But those answers are more around because my question to them was more framed about like what, at the end of the day, if you're doing value-based care, you need to affect change in the patient's behavior, not in your own behavior. So how do you do that? But what you're approaching is the other side of the question. And this is something new to me, and I love it. And that is that there's another piece to this. The other piece is it's not just about how the doctor can influence the patient from kind of a top-down level, but how can we remove, and now that I'm speaking this out, maybe it seems super, super elementary, but how can we remove a bunch of these barriers for the patients? Because at the end of the day, my incentive is that I am healthy, feel good, and live longer, and I know that. But the problem is that we as humans are used to instant gratification, right? And so if I don't go to the gym and get abs today, then I'm not doing it, right? And it's very, very difficult for us to appreciate that the long-term effects and the compounding interest of taking care of our health, because it's a long-term effect. And so if every barrier is so critical, because at the end of the day, if it becomes overwhelming, if I have to sit on hold for 40 minutes and if I have to do all these various different things, I'm just not going to do them because I don't feel the risk enough. So the doctor's sitting there feeling the risk on the payment because they're the ones that are getting dinged or they're the ones that are getting paid. So for them, and that's why I think this is the other side of this. So for them, it is instant gratification, and that's why they're incentivized. But the more that you can remove the barriers, the more you can get closer to instant gratification for the patient. And the closer you can get to a place where the patient feels like, hey, it's actually kind of a breeze to do this. And I do at some base level, everyone understands it's important to be healthy and it's important to get my annual, it's important to get my preventive tests, it's important to get my screenings, whatever those things are. But it's got to be easy.
People will do most things that are easy. Like, let's be honest. Like, the reason we're all on Amazon at night is because it's easy. Like, if I had to go to Target, if that was my only option, I'd buy less stuff. Like I would. Like, I mean, like that's what would happen probably. And so, like, I think you're getting it. We have to remove friction. Like, we have to remove barriers and friction, and it comes from the perspective of barriers, as in like care, right? So I can't get there. I don't have transportation. I don't have money, right? So we have to think from that, like that gets into the equity and the social determinant side of things. And we can use data to understand that. And then we can remove those and provide solutions. We have to come in the frame of technology. Like, and why in the world are we sitting on the phone, making phone calls or rescheduling our care? Like, I don't have to do that for anything else. Like, it's mind-blowing. Right. There is friction that can be removed through technology. Like, we can get rid of those barriers. And then where it gets murkier and harder, I think, is then the barriers around motivations and influences. So like, what motivates me? What motivates you? Yeah, we want to be healthy, but like, if it's easy, I'll do it. Or if it's somebody who's really presented me all the research, right? And I really understand that research is valid, then I'll do it, right? So like, what's our motivation influences? We could do that. And then where it gets further murky is cultural. Right. So how do we understand? And I don't know that there's a simple answer here, but how do we win trust in areas in with groups of people where we have, justifiably lost trust? And how do we win back that trust through culturally sensitive care? And I think we see a lot of that. We talked at the top, like before we got on the phone, like a little bit of that segmentation happening in healthcare. And I think that's another area, but those are the barriers that if we can, and I think a lot of them can be removed, and we can get major lift because we have the data. We understand patients. We know what's going on. We know their motivations. We know how to interoperate. Like, there's tons of technology-wise. Like, technology is never the problem. Like, it's people and process, right? Like, so like, how can we do those things? And the other thing I would say, when you talk about the providers owning like the responsibility, and they do. That's how our system is set up. We also love to say it's patient-centric. So like, you're in charge of your care, but we're not going to tell you anything. So like, you're in charge.
I don't even know my chart. What are you talking about?
Right. And you go into your chart and you go to 2 or 3 different charts and you have different recommendations. You know what I mean? So how would I know what I'm supposed to do? Do I do that when I'm 45? Do I do that when I'm 50? Like, I'm getting different feedback. So then we go to Google or our neighbor. And so like that's silliness. Like, so I think if we're going to do patient centric, then we have to enable patients to do the things we need them to do. And all of those barriers and friction, get them out of the way, and people will generally do stuff. Like,
yeah,
because you're right, people generally want to be healthy.
Yep. Well, I absolutely love what you're doing. Huge fan. And congratulations. I understand that you will be speaking at South by Southwest. Talk to us a little bit about that. What's that?
I'm
What's excited.
That like? Yeah, we are speaking a little bit irreverent. I think fitting for the audience probably at South by Southwest. But why is healthcare doing more or doing less with more data? So some of the things that we hit on today. Jan Berger and I will be down there and really just spending a little bit of a fireside chat talking about what are the obstacles in using data and how do we think about overcoming them. Again, a lot of that stuff we previewed today, and I'm excited about it. And I'm excited to be in a group of people who are thinking innovatively across industries. That's the other part. Like I said, we were talking about entrepreneurship. Like, it's not just healthcare, right? Where like you get is a healthcare entrepreneur. Like, that's not where all the ideas are. Sometimes you get to bring in ideas around consumerism from other industries and ways of thinking that can generate new opportunities to improve. So,
yeah. Well, congrats on everything that you're building and the success that you've had and will continue to have with Upfront Healthcare. And what's one goal that you want to smash in this 2024 year?
2024. I think that this is a really great question because there's always so many.
There's so many, right?
I was like, I just want to fix it. I'm just going to fix healthcare this year. I think where I really wanted to think about this year with our team is how we are really elevating our approach to personalization analytics. And for us, that is how do we think about really doing some AI-enabled work in a very thoughtful, equity-oriented way. But we've been pretty advanced in our approach to personalization analytics. And so the idea that we are going to push kind of to the next level is probably our big mission for the year that we're excited. And I think the team is really excited to have some fun with that too. So,
well, it sounds exciting. Like I said, tremendous continued success. Good luck at South by Southwest. I'm sure the crowd is going to absolutely love you. And thanks for spending time today.
Likewise. Thanks for having me. It's good to see you.